Welcome to This Explainer. Today, we're jumping right into the clinical realities of our modern invisible environment. We'll be unpacking some truly fascinating clinical practice guidelines from Dr. Rena Bray. She outlines a condition that's becoming incredibly relevant and maybe even a little urgent in our ultra-connected world. Let's kick things off with a crucial question. How exactly might the ubiquitous wireless technology all around us be causing severe functional impairments in certain susceptible individuals? I mean, we are constantly swimming in a sea of frequencies, right? And for most of us, it's completely unnoticeable. But what happens when the human body actually starts reacting to it? Well, that brings us directly to EMR syndrome. Now, the clinical guidelines define this as a recognized spectrum disorder where patients develop some really debilitating responses to the exact same electromagnetic fields that we rely on every single day. You might have heard older terms for this in the past, like EHS, but throughout this explainer, we're going to stick strictly to the updated clinical terminology, EMR syndrome. Our roadmap today follows a clear clinical path. First, what exactly is EMR syndrome? Second, recognizing the symptoms. Third, uncovering the root causes, or etiology. And finally, clinical and practical management. So let's jump right into part one, what is EMR syndrome, and establishing the clinical reality. To really grasp the severity here, it is absolutely vital to know that environmental sensitivities are officially recognized as a disability under the Canadian Human Rights Commission. Think about that for a second. That is a massive point. It provides some much-needed validation for people suffering from what is, frankly, a highly stigmatized condition. These patients frequently deal with severe functional impairments, sometimes losing their jobs or, worst-case scenario, even facing homelessness just because their reactions are so intense. Moving on to part two, recognizing the symptoms, or how the body actually reacts. When we talk about symptoms of EMR syndrome, they typically cluster into four main categories: neurological, cardiac, dermatological, and vegetative. And we're talking about real severe impairments here. Patients report intense headaches, thick cognitive brain fog, and highly disrupted sleep where they're just not getting that crucial REM cycle. Then there's the cardiac side, which, as you can imagine, is particularly terrifying. They experience nighttime tachycardia, racing hearts, and premature ventricular contractions. That basically feels like your heart is randomly skipping a beat. Throw in skin issues like erythema, which is severe redness, and deep vegetative symptoms like absolute extreme fatigue, dizziness, and nausea. It's truly a full-body, multi-system response. All right, part three, the root causes, or etiology. Basically, uncovering the why behind all this. This leads us to a really fascinating concept called the total toxic load. I want you to picture a patient's body as a detoxification bucket. Every day, various environmental stressors, workplace exposures, maybe mold, poor diet, everyday stress, heavy metals, and radiation, they all just keep pouring into this bucket. Now, the degree of impairment a person experiences depends heavily on their unique genetics, which might predispose them to having a smaller bucket, so to speak. When those combined stressors exceed their maximum tolerated dose, known in medicine as their allostatic load, well, the bucket overflows. And that is exactly when EMR syndrome manifests. To organize this clinically, the guidelines group these vulnerabilities into 7 distinct categories. And this is so interesting because it highlights just how diverse the root causes really are. For example, the first category looks at toxic heavy metal burdens, like mercury from seafood or dental amalgams. Category 2 points to infectious diseases that cause neural inflammation, think late-stage Lyme disease. Then you've got patients with pre-existing brain lesions or cardiac rhythm disturbances. A particularly relevant one today is Category 5, which involves students and teachers facing massive, prolonged classroom exposure to Wi-Fi and fluorescent lights. Now, the guidelines do note that a small minority, about 1%, exhibit a nocebo response, basically negative expectations causing physical anxiety, while the final category involves overlapping multiple chemical sensitivities. So, here's the absolutely crucial takeaway. How does this radiation actually harm the body? Well, historically, safety standards focused entirely on thermal effects. Basically, does this radiation heat up your tissue? But EMR syndrome is driven by non-thermal biological damage. We're looking at things like cellular oxidative stress, actual DNA damage, and the dysregulation of voltage-gated calcium channels, which are essentially the electrical gatekeepers of our cells. It can even increase the permeability of the blood-brain barrier. So it is a profound biochemical disruption, not just a simple heating problem.
To actually map out this toxic load and give a proper diagnosis, physicians use some really specific tracking tools. They use a mnemonic called CH2OPD2, which sounds like a droid from Star Wars, I know, but it stands for community, home, hobby, occupation, personal habits, diet, and drugs. It's a way to thoroughly investigate a patient's total lifestyle exposures. On top of that, to pinpoint the specific parameters of their electromagnetic environment, doctors use the FIND acronym. That means they are tracking the frequency, intensity, nearness, and duration of the exposure.
Now, getting to a diagnosis can be pretty tricky. Interestingly, about 30% of EMR syndrome patients will actually show completely normal standard lab results. But when doctors look deeper with specialized testing, it can be incredibly revealing. They look for abnormalities in specific biomarkers, like elevated histamine, sudden drops in vitamin D, or high nitrotyrosine levels. That last one is a big red flag because it indicates an increase in nitric oxide production, which can make that blood-brain barrier more permeable. Finding these clues helps physicians map out a patient's unique biological distress. Let's move to part 4, clinical and practical management. How do we start emptying that bucket? The clinical guidelines lay out a really comprehensive 3-step management protocol. It's a hybrid approach combining traditional allopathic or conventional medicine with aggressive environmental remediation and finally integrative lifestyle changes. Let's break these down step by step. Step 1 is all about targeted relief. You have to remember, these patients are often in severe distress, so physicians might prescribe specific medications like antihistamines with sedative effects to just desperately restore some normal sleep patterns. For those terrifying nighttime tachycardic spells where the sympathetic nervous system is in total overdrive, beta blockers like bisoprolol or propranolol are highly recommended. Also, if the patient happens to have a high toxic metal load, gentle chelation therapy might be required. That's a medical procedure that essentially binds to and extracts those toxic metals safely from the body. Step 2 requires aggressive environmental remediation. You've got to stop the exposure right at the source. The guidelines highly recommend bringing in a certified building biologist, someone who can actually physically measure the fields inside a home. The key action items: physically hardwiring internet connections using Ethernet cables and completely shutting off Wi-Fi and Bluetooth. Patients absolutely must remove potent internal emitters too, like DECT cordless phones and smart meters. And in extreme cases of external exposure, say from a cell tower right across the street, patients can even use metallic reflective paint on their walls to literally block the incoming signals. Step 3 is all about integrative and lifestyle fixes to help heal that biological damage. Because oxidative stress is such a core issue here, eating an antioxidant-rich diet is absolutely critical. We're talking heavy supplementation with vitamin D3, omega-3s, and glutathione. To guarantee restorative sleep, patients are even advised to sleep inside a Faraday canopy, which acts like a physical shield against any ambient signals. The guidelines also suggest natural grounding practices. Think walking barefoot on sand or grass to replenish lost electrons. Though, side note, they strictly warn against doing this anywhere near hydro wires. Oh, and a very practical, everyday tip for all of us: completely discontinue using AirPods or wireless earpieces, just given their intensity and how close they sit to the brain. Finally, part 5, advocacy and public health. Basically how we go about changing our broader environment. True, systemic management requires real advocacy. The guidelines push for some essential public health action items to get this done. This means making institutional accommodations for sensitive students, like ensuring they get to sit as far away from classroom routers as possible and providing them with hardwired laptops. It also means we need widespread continuing medical education, or CME, for physicians so they actually know what they're looking for. Plus, the implementation of mandatory screening surveys in primary care clinics so we can finally recognize just how common these exposures have truly become. All of this leaves us with a final, rather provocative thought. As we've seen through these clinical guidelines, the biological impact of our environment is incredibly real for a growing subset of the population. So as our world becomes increasingly saturated and completely wireless, what steps must we take today to protect the health of the most vulnerable tomorrow? Thank you so much for joining me for this explainer. Keep questioning, keep learning, and I'll see you next time.